We Are TB is a survivor-led advocacy and support organization that particularly is interested in the survivor experience and stories. We use our platform to amplify these voices and advocate on behalf of eliminating TB. We Are TB serves survivors and patients of tuberculosis, both active TB disease as well as LTBI, latent TB infection. And we're interested in supporting the entire affected community. A primary partner in this project for We Are TB is the Wisconsin Tibetan Association, which is a community-based organization in Madison, Wisconsin that serves the Tibetan community in the local Madison, Wisconsin area. So this unique partnership is supporting with the expertise and the resources from We Are TB. We're aiming to serve and really be of service to the Wisconsin Tibetan community here. Another partner that is important to highlight is Public Health of Madison and Dane County. We're working pretty closely with that team to provide educational resources and also, since many of the staff have worked with community members and have built some rapport, want to use them effectively and continuing to build relationships, but also their expertise and potentially working to create testing and screening clinics as well. And so this is a unique partnership of 3 different organizations and all which are kind of coming together for one purpose and one goal here. This project initially came together from my idea initially as a We Are TB member, one of the leaders within the group. And I've been part of the Wisconsin Tibetan Association and the community since I was just 6 years old. And so growing up, I learned about TB. I knew members within the community who had been affected by TB. And once I had actually was diagnosed with active TB disease, I soon got involved with an advocacy group, We Are TB, which is at its early stages of growing. And so this partnership came to be because of the different kind of connections I had within both organizations. And having returned back home to Madison, Wisconsin, presented an opportunity to really serve the community in a unique capacity. And my previous relationships as a patient and my family's experience with TB and being treated in Madison as well, I was able to revisit some of those relationships and make those connections for this project. So at the center of this project, I'm somewhat piecing things together and making the connections for the communities. And so far, it's been really amazing to see the relationships being built and the connections that are being fostered. This mini grant project with We Are TB and the Wisconsin Tibetan Association aims to cultivate a community that is really invested in advocacy, but primarily through creating education and resources to engage the community. So we're really aiming to, and one of our primary goals is to create awareness between the link between TB disease and LTBI. And with this, we want to, one way we would want to do this is through cultural and linguistically appropriate education around TB and LTBI, and providing community engagement opportunities to bring in survivors and patients to amplify their stories and center their experiences. We really aim to address misconceptions around TB and LTBI provide opportunities for education, and reduce stigma within the community when it comes to TB and LTBI. It's essential to understand how stigma plays out in this particular cultural context, and really engage the members in ways that they feel comfortable sharing their stories, and being able to highlight their resilience and empowering community members to make informed decisions, and cultivating a sense of agency themselves. So we're really hoping for people to be open with their experiences and stories, and we're doing this initially through interviews and starting to build the capacity of survivors and advocates, and primarily through community building and creating spaces for dialogue, especially across generations. This mini grant project is really important for the Tibetan community because the Tibetan community often is, I would say, overlooked when it comes to TB and research as well. So when I'm trying to look for information about and data around how much Tibetan Americans in particular are impacted by TB, it's very difficult to find. And anecdotally, it's quite obvious the disproportionate impact that Tibetan Americans are experiencing TB and likely LTBI. So considering that the majority of active TB disease is from longstanding LTBI, it's essential and really important that we do what we can to prevent active TB disease, especially in our community, and to provide the tools and resources for people to have the information and the education, and also just the resources to prevent it. So more importantly, this is an opportunity to amplify and uplift the voices of those that have been most impacted, and give them a platform to no longer be worried or ashamed of some of the stigma that exists. Sometimes not even explicitly, but because of some of the apathy around TB and LTBI within the community. So hopefully this will provide the space and allow people to learn more about TB and LTBI, and to be able to make those kind of decisions to protect themselves and also the community. So I think this is a fantastic opportunity for people to learn more, to reduce stigma, and to create a stronger and healthier community.